Hello friends, today we are going to see about the fourth cranial nerve, that is trochlear nerve. In this component we have to see about introduction, functional components, location of nucleus, course and distribution of trochlear nerve and the clinical anatomy. First of all, we see about the introduction. This muscle supplies superior oblique muscle only. Already we know about this mnemonic elastic S04. So here the superior oblique muscle is supplied by our fourth cranial nerve, that is trochlear nerve. Next we see about the functional components. Here the general somatic efferent is used for lateral movement of the eyeball. And the general somatic afferent, it is useful for the proprioceptive impulses from the muscle to the mesencephalic nucleus of fifth nerve. Next we see about the location of nucleus. Here the trochlear nucleus is situated in the midbrain at the level of inferior colliculus. The location is accurately pointed out as ventromedial part of central gray matter of midbrain at the level of inferior colliculus, and it is also closely related to the medial longitudinal bundle. Next we see about the course. The first one is intraneural course. Here the nerve crosses the central gray matter and reaches the superior or anterior medullary vellum, and here it decussate with the opposite nerve. And this nerve is attached to the superior medullary vellum on one side of the frenulum vellae, and also it is the one and only nerve which emerges on the dorsal aspect of the brainstem. Then this nerve winds round the superior cerebellar peduncle and the cerebral peduncle, and also passes in between posterior cerebral and superior cerebellar arteries. Then it enters into the cavernous sinus by piercing the posterior corner of the roof, and it travels in between the oculomotor and ophthalmic nerves. And in the anterior part of sinus, it crosses over the oculomotor nerve and enters into the orbit through the superior orbital fissure. Then it passes medially above the origin of the levator palpebrae superioris. Then it reaches the superior oblique muscle. Thereby it supplies and ends its course. This is the diagram of the course and distribution of trochlear nerve. Just go through this diagram and understand. Here the trochlear nerve nucleus is marked at the level of inferior colliculus. Just go through this diagram. Then we see about the clinical anatomy. When the trochlear nerve is damaged, diplopia occurs. Diplopia means double vision. And also the paralysis of the trochlear nerve results in defective depression of the adducted eye and also diplopia. Thank you.